Good afternoon or good morning, everyone, depending on where you're joining us from. Thank you for joining today's mini symposium, What COVID-19 Taught Us About the Importance of Rehabilitation Technologies Research. My name is Mahdi Tavakoli. I'm a professor in the Department of Electrical and Computer Engineering at the University of Alberta. This mini symposium is being brought to you by the SMART Network. SMART Network is a network of researchers at the University of Alberta. In a moment, I'll invite Dr. Vivian Mushahwar, who is the director of the SMART Network, to say a few words about the network, and then we will start with the speakers. Before I get started, just a few housekeeping items. The first thing is that today's mini symposium is being recorded. The second point is that we invite you to put comments and questions through the Zoom's chat box. If you can think of any question that you have for speakers, please just type it in the chat box, and I'll make sure to either pose it to the speaker at the end of the talk or keep it for one of the two roundtables that we will have during the symposium. And the third point is, if anyone wants to receive a certificate of attendance, please just leave me a message with your name and email address in the chat box, and I'll be sure that you receive a certificate of attendance. At this time, I'm going to hand the floor over to Dr. Mushahwar, who is going to talk about the SMART Network. Vivian, could you please unmute yourself?
Yeah, thank you very much, Mahdi, for organizing this exciting and timely symposium on behalf of the SMART Network. I'd like to take a few minutes this afternoon to introduce the SMART Network to all of you who are joining us today. As some of you may already know, SMART stands for Sensory Motor Adaptive Rehabilitation Technology. And as Mahdi said, we are a network of 40 labs and more than 250 professors and learners at the University of Alberta. Our members come from many different disciplines, including medicine, rehabilitation, engineering, computer science, art, social science, health economics, and consumer needs. And collectively, we focus on achieving the vision of a future with improved abilities and life experiences for all, but especially for persons experiencing neurological conditions. So our mission is to develop intelligent health technologies and innovative rehabilitation interventions that improve functional outcomes for persons with neurological conditions. And our goal is to take these innovations to the clinic to improve quality of care and patient outcomes while also reducing healthcare costs. We focus on complex, unmet medical needs, including the restoration of mobility and sensation, prevention of injuries and secondary complications, and delivery of healthcare in remote communities. And perhaps most relevant to the times of a pandemic like the COVID-19 pandemic is our focus on intelligent technologies that allow for accurate assessments, diagnosis, and delivery of rehabilitation while also maintaining physical distancing and even social isolation. The technologies we develop at the SMART Network allow for continuous, precise monitoring and diagnosis. And these technologies also provide precise interventions that are adaptive to each person's needs. So in other words, our technologies allow for the right intervention to be provided at the right time to the right person. Now, just to give you a very brief history of the SMART Network, the SMART team was officially established in 2009 through funding from the Alberta Heritage Foundation for Medical Research, which some of you would know is a predecessor of Alberta Innovates. And over the years, we were able to secure space and equipment. And now the SMART Network has 16,000 square foot of shared space, equipped with about $14 million of state-of-the-art equipment that allows for rapid prototyping and development of technologies from concept to validation. Our network's multidisciplinary team approach to projects allows the technologies to be developed in a manner that meets the end user's needs, making those technologies more readily available for uptake in healthcare and the marketplace. And in 2019, and with support from the Government of Alberta Department of Jobs, Economy and Innovation, we established ST Innovations, which is the business arm of the SMART Network. This allowed us to open the SMART Network to the health technology sector in Alberta, providing this sector with a rich platform for technology development from concept to clinical validation. And collectively, the Smart Network has established an incredible ecosystem that accelerates discovery and its translation to social impact. And this ecosystem expands the health technology capabilities in the province and supports an innovation-based health economy. Now, I invite all of you interested in the Smart Network and ST Innovations to check out our websites. I'll be including the links momentarily in the chat box. Please feel free to contact us for additional information, and we look forward to discuss opportunities for collaboration. With that, I turn it back to you, Mahdi.
Thank you so much, Vivian. So the motivation for the series of talks that you're going to hear today comes from the remarkable severity of the coronavirus pandemic and the tragedy that it has caused. And these should serve as a catalyst to promote discussions that reconsider at a fundamental level how healthcare services are delivered and how more extensive, targeted, and deliberate use of technology can reduce the loss of life and alleviate the burden on the healthcare staff in the future. This workshop will discuss how technological innovations for post-secondary and injury physical rehabilitation and assessment can play a prominent role, either by facilitating the prevention, containment, and mitigation of COVID-19, or by providing general support for patients and medical staff to alleviate the non-COVID burden placed on healthcare systems during the present crisis. The workshop will also consider the question of how future research and education in rehabilitation technologies should be shaped to better aid the healthcare system, healthcare workers, and patients during the next pandemic. The workshop will recognize the potentials of smart wearables, robotic technologies, and artificial intelligence, just to name a few examples, for meeting the rehabilitation system's need for a safer, more robust, and more efficient delivery of care to everyone in the future. So without further ado, I'd like to show you the schedule of the workshop. We have a packed schedule today. The first speaker is Professor Martin Ferguson-Pell. Dr. Ferguson-Pell is a biomedical engineer and credentialed clinical scientist. He designed and developed a rehabilitation robotics laboratory in the Edmonton Clinic Health Academy. His team develops advanced virtual reality and augmented reality systems for a wide range of applications in healthcare. Dr. Ferguson-Pell was one of the founders of the Smart Network and has been involved in the development of several health technologies and a number of startup companies. So with that, I'd like to welcome Dr. Ferguson-Pell.